Ladies and gentlemen, please welcome the very informative and always entertaining Dr. Allen.
Thank you very much. Thank you, Ari. Thank you. You know, I got a call from a patient the other day, and they were complaining to me about these upper respiratory symptoms, cough, cold. We went through the whole discussion with them, and then something happened that unusual. I got off the phone, and about an hour or two later, I started coming down with the same symptoms that they had on the telephone. And it was really weird, and then I realized, and I didn't know this, that what they had was actually telecommunicable. It's a new strain of virus, Ari.
It brings a whole new meaning to phone relationships.
That's right, social media. Now you can catch it over the internet. I know as you get older, sometimes you experience problems with your memory, and dementia is prevalent in the elderly population. But I've got the remedy for your dementia when your memory starts to go. This works guaranteed better than fish oils. What you got to do is you got to make sure all your friends all have the same name. You're not allowed to befriend anyone who has a different name than that chosen name you choose. This way, you'll never be in the awkward position of having forgotten their name. Another remedy you can use is just make sure you have 3 pairs of the identical eyeglasses with you at all times. So this way, when you forget the pair that's been sitting on your head already and you have to find something, you just reach into your pocket and go for the next pair, and no one will know the difference. You know, one of the treasures of becoming older is becoming a grandparent. I can't think of anything more wonderful than having a grandchild and spoiling them. But I got to tell you something. You got to be careful about spoiling your grandchild with that lint-covered candy that's been sitting in your pocket next to your right testicle for the last 9 years. And when you give it to them, I mean, you're not spoiling them. You're creating a complex that is going to take a team of psychotherapists the next 20 years to rectify for them to lead a normal life after that. Ladies and gentlemen, we have a great show for you today. We have our healthcare expert on the show. We have a segment we call Second Opinion. We have our medical expert panel. Please say hello to my good friend, Mr. Ari Kazel. Don't go away. We'll be right back. Thank you. Welcome back to the show. Before our next guest comes out, Ari, I'm going to give you the choice today. You decide what we're going to chat about. Is it going to be medical food-related items, medical potpourri, or things you don't want to hear your doctor say?
For 200, Alex, I'll take that last one.
Things you don't want to hear your doctor say?
Absolutely.
Okay, Ari. So I've compiled a list of some of the things that you really don't want to hear your doctor say. Here we go. You won't be needing this piece anymore. That's something definitely you don't want to hear your doctor say.
I heard that once.
How about, oh crap? Definitely something you don't want to hear from your doctor. How about, don't worry, a little bit of makeup will cover that up.
Not if he's your surgeon, right?
If not if he's your surgeon. How about, I have some bad news? That's never a good thing.
No, unless there's a birthday cake involved or something.
No, you don't want to hear when your doctor says I have some bad news.
Okay.
How about, bend over, this will only take a minute?
It's different if it's in a doctor's office or not.
Yeah, well, we're not talking socially.
Okay.
We're talking in the doctor's office, sorry. Things you don't want to hear say. Let me repeat that again. Things you don't want to hear your doctor say.
Thanks for clarifying that.
Okay. Don't worry, I just got my license back yesterday. And finally, the last thing you don't want to hear your doctor say is, I saw this on the Learning Channel last night. Okay.
Those are good.
My first guest is a periodontist. For those of you who don't know what that is, that's a gum specialist. He practices in Woodbridge, Ontario. He's going to talk to us about oral health and aging. Please welcome Dr. Perry Shivitz. Welcome.
Thank you, Dr. Allen, for having me.
So let's just delve right into things. What are some of the trends you're seeing in terms of oral health and aging?
Well, some of the trends we see as people get older are an increase in missing teeth, they're not being replaced, an increase in periodontal disease, an increase of gum recession and root exposure and root sensitivity and caries. We also see an increase for need of replacement of restorations because each restoration has their own lifespan. And we see an increase in grinding and wear of teeth as well.
So you do dental implants as well.
Yes.
Are you seeing a lot more use of dental implants with the technology being where it is right now?
Compared to earlier years, yes. People are more aware of dental implants. They're asking more for dental implants, and they're having more dental implants, and we're seeing the problems associated with dental implants as well.
What are sort of the problems you see with dental implants?
Periimplantitis, where the gum adhesion to the implant loosens, loss of bone, even some implants that don't take.
So when something like that happens, it's a failed implant. Does it have to be removed?
Well, only if the implant is painful or loose, it has to be removed. If there's some bone loss around the implant with no pain or anything like that, it's still left.
Okay. People talk about a relationship between your oral health and your health in general. What do you see as the relation between oral health and other generalized healthcare issues?
Well, there has been recently discovered associations between severe periodontal disease and certain other general health conditions such as cardiovascular disease, chronic pulmonary disease, diabetes, for example.
Getting on that topic, there is a discussion in the community about inflammation relating to coronary artery disease and really vascular disease in general, and they're making some sort of links to the mouth and oral health.
Yes, what's happening is that many people with poor oral hygiene, severe untreated periodontal disease, they have certain bacteria and certain substances that cause inflammation that enter the blood vessels in the gums and travel to other parts of the body and cause problems in other areas of the body.
So literally, the mouth is a portal to the rest of your body.
That's right.
Wow, fascinating. What are some of the medications, I wanted to know, that affect your oral health? Because as you get older, there's this phenomenon called polypharmacy, where people are on multiple medications, and does it have implications on your oral health?
Many medications do have implications. There are probably over a few hundred medications that cause a decrease in saliva flow and dry mouth.
Why is that significant?
That's significant because if the salivary levels flow below a certain level, you have an increased incidence in root caries, crown caries, gum inflammation.
So what are some of the kind of things that people can do to alleviate some of these risks?
In terms of dry mouth?
Well, in terms of your oral health in general.
In terms of oral health in general, first you have to realize that the mouth is a high maintenance area of the body. One big step is to improve one's oral hygiene level. Many people don't floss consistently or daily. So I would say add flossing on a daily basis to your oral hygiene regimen. If you can't handle the floss, use proxy brushes, for example.
What is a proxy brush?
A proxy brush is a small little brush, almost like the end of a toothpick, attached to a handle that's used as a toothpick in between the teeth, where the regular brush does not get well.
This is a personal question of mine, and I've always wondered this. What is more important for your oral health? Is it more important to brush or to floss? If you had to do one.
That is a question where the answer is you have to do both. It's not a matter of which is more important than the other. If you don't brush, you're more susceptible to periodontal disease on the cheek and tongue sides of the teeth. If you don't floss or use the proxy brushes, you're more susceptible to periodontal disease in between the teeth. So my answer is you have to do both equally.
So it's not a one or the other. Both of them work together synergistically to maintain your oral health.
That's right. You have to do both daily and consistently and for the rest of your life.
Wow.
How does having or not having good teeth, in terms of diet, how does that affect your health and your ability to choose what you're going to eat?
Well, if you have pain to chewing because of, let's say, cavities or gum infections, or you don't have enough teeth to chew efficiently, that can affect your selection of food, how well you masticate or grind the food, and it can affect your diet as well.
So it affects your choices?
It affects your choices, it affects your ability to chew, it can have effects on your digestive system as well.
Wow, this is fascinating stuff. I'm glad you came on to educate us on oral health. I'd like to thank you for appearing on the show for us. It's always a pleasure to have you out here. Please give a hand for Dr. Perry Shivitz.
Thank you for inviting me.
Don't go away. We'll be right back. Welcome back. Chronic pain physician who practices in both Markham and North York, Ontario. He's received many accolades and awards for both teaching and clinical practice. Please welcome to the show Dr. Kevin Rod. Hi, Kevin. Welcome. Welcome to the show. So, Kevin, you are actually the developer of SenioLand, which is the sponsor of the show.
That's right.
Can you tell us what is SenioLand?
Alan, SenioLand is an online platform for seniors and whoever cares about them.
Now, what do you mean an online platform?
It's an environment that we have created for seniors who may feel lonely or isolated in the society, so they can go there, they can connect, they can have their say, basically.
So what was your inspiration and what drove you to develop this sort of, I guess, home for seniors called SenioLand?
Well, and you and me both work in the area of chronic pain, and you have noticed that, especially over the past few years, the number of chronic pain patients that we see who belong to the senior age are increasing. And over years, I've noticed that they suffer from a lot of loneliness and isolation. When I looked into it in a deeper way, I realized that we are actually facing a deep moral issue in our society in these days. I believe that the seniors, regardless of how much experience and knowledge and wisdom they have gathered over the years, they are pushed to the sidelines of the society, and that's a fundamental issue that we have today.
So this has the potential to become big. I mean, our population is graying at an enormous rate, and in 20 years from now, our demographics are going to be very much senior-oriented. So what is the platform here? You mentioned SenioLand. How does someone access it?
Well, SenioLand, we have the website, and again, getting back to that moral issue, if you, the essence of it is that if you look at the society, you have the senior military officers or senior scientists or senior ministers. They have a lot of power. Whatever they see, everybody would follow. But as soon as they become only seniors, so meaning that they don't have the job anymore, but they're just a senior, still have the same knowledge, the same wisdom, the same ability of participating in the society from their knowledge base, but they are pushed away to the sideline of society. Nobody listens to them anymore. This website and this social platform creates an environment for them to be able to come back to the mainstream of the society and still contribute to the betterment of everybody's life.
So I think what I'm hearing you say is that we have seniors with an enormous amount of knowledge they've accrued over the years, retire, and then that knowledge sort of dissipates away, but this is a platform and a way for them to continue to enrich society with the knowledge and experience that they've gained over many years of employment.
Exactly. There's an ocean of knowledge and wisdom and experience that's out there that's not being used because there is no platform for them to go and get connected.
So what is your target audience? I know the name implies seniors, although it's not senior, it's SenioLand. Yeah. But I would anticipate that a lot of really elderly seniors may not be computer savvy and be able to access the internet or have access to the internet.
Well, if you look at the statistics, you may be very surprised that the fastest growing group of people who are using Facebook these days are seniors, actually.
Actually, that does fascinate me. I would have never guessed that.
It is, and what they're looking for, even more importantly, is quality material because they have time and they have the knowledge, don't forget. So everybody who's putting information online has to be careful because they will be assessing it very well.
So getting into a little bit more specifics, what are the actual things someone can find on this website?
There are different rooms that they can go into and get connected. They can have their say about different subjects. They can passively sit and read about different information related to their lives and the society related to their issues, but they can contribute, they can participate. We have coined many cool names, for example, Senior Rate or Senior Corner. Senior Corner is when they can go get connected and have a discussion about different
So is this sort of a blogging corner where they can go on and communicate with each other and talk about things?
or a forum, whatever you want to call it. A senior rate, they can go and rate or say yes or no or like or dislike about different subject, different issues or different products. So basically they can have their say. Now imagine, Alan, if a day comes, I don't know how long from now, that 1 million or 2 million seniors go to one platform and say yes or no to any subject. You tell me which politician would dare not listening to them.
Well, we know that there are power in numbers, and in a
Exactly.
democratic society, everyone's got to vote no matter what their age.
That's
This
right.
has the potential to unite and have seniors' issues pushed to the forefront that really no one can ignore.
That's the goal that I hope that in a few years we'll reach. But today what I'm looking for is to bring out every single senior who connects to our platform out of isolation, out of hopelessness and helplessness, and feel that they are coming back to the mainstream of the society.
And being continued contributing members to society despite retiring from the general working world.
Do
Exactly.
you see this at all as a way for the younger generation to seek the advice of these people who are experienced seniors and have advice to offer? Is there something available on the site? for
That's why we call it a platform for seniors and whoever cares about them.
that? Okay, or seeks their advice.
Kevin, I appreciate you coming on the site, very informative. Thank you very much, Dr. Kevin Ross.
Thank you.
Don't go away, we'll be right back. Welcome back. Welcome back to our medical expert panel discussion. To the right of me, Dr. Paul Drusen, a family physician who's practiced emergency medicine, hospital-based medicine, rural and urban family medicine. To the left of me, Dr. Roman Ellison, who's a family physician in Toronto, who also has a house call service in Toronto. Gentlemen, welcome. Let's get right to it. I'd like to bring up some topics such as user fees. Has the time come in our healthcare system to institute user fees? Paul?
I'm going to say yes.
Why?
Well, because there's a great drain on our healthcare system right now because of overuse of it and unnecessary use. And user fees would be one way of slowing that down, of mitigating that.
But there would be some that would argue that instituting user fees will simply cause people with real medical problems to present at a later stage in their illness, to become sicker, and actually, in the end, cost the system more.
I think the user fees have to be small enough that if you feel that you're ill, that you'll pay them. You'll be able to pay them if you have to. I mean, they shouldn't be exorbitant. They shouldn't be that you cannot pay them. They should be small. They should be small, but they should be there.
Roman, what are your thoughts on it?
I mean, on the one hand, I agree. I think our healthcare system is very expensive. It's probably not sustainable, and something needs to be done about it. Not sure that user fees are necessarily the answer. I mean, I think there are a number of provinces, if I'm not mistaken, that have already tried instituting user fees, and I think that they've all sort of failed for various reasons. If you have a small user fee, it could be too small to generate the required revenue. So, how small do you make it?
Well, it's not a revenue thing. It wouldn't be
It's
a
not a
revenue.
revenue.
No, because medicine is so costly and a doctor's time is so costly, and it's not to generate income. It's to prevent abuse of the system.
Oh, so it's a
So-
deterrent. Use it as a deterrent.
Well, often people go to the doctor for the slightest provocation. They don't really need, in their own mind, they don't really need
See,
one.
I would argue that you're right that there probably should be some kind of deterrent for people going to see the doctor for no good reason. But if it's an economic deterrent, what it probably will do is deter the people that don't have the money. So you're going to see the economically disadvantaged not going to see the doctor, and the people that can afford it will see the doctor anyway, still for no good reason.
Well, then there should be perhaps a grading system. Perhaps people from a certain income would have less of a user fee.
Right,
Or
and
it'd be
then,
a
but then you get
proportionate-
into how do you manage? Who charges the user fee? Is it the doctor's office that charges the user fee? Is
Well,
it the government?
that's a good question.
That charges.
How
you
would
That
this
wasn't
be-
the original question. The original question was whether should there be, and I would say yes. How it's managed is a.
But
something that has to
managing
be
user
addressed.
fees could become like a ridiculously expensive proposition. and sort of
I
very
don't think
bureaucratic.
it's as ridiculously expensive as the abuse in our current system.
Gentlemen, let me chime in for a minute here. I would think that the actual administration of a user fee, as Roman was alluding to, might actually consume more resources than are brought in from the actual user fee. But as you were saying, that the purpose is not to actually make a profit from the user fee, but to deter unnecessary use of physician services. Instituting the fee would be a very difficult thing to do. What if someone comes to visit their family doctor's office and simply does not have the money with them? Do you turn them away at the door?
What do we do with people who present to the family doctor's office without an OHIP card?
Well, right now it's up to your discretion, I presume.
It would be the same thing.
So you're adding another. I mean, who enforces the user fee upon the doctor? So what if Dr. A says, look, you know what? I need new patients, so I'm not going to charge a user fee.
But then you're sort of talking extra billing now. So who's Uncle Sam watching over the doctors
Right, so
collecting
you-
the
so you
fee
need to enforce.
and to submit it, or is it simply just extra billing back to the 1980s, which was removed at the doctor's discretion, and who's going to keep tabs on the doctor? I don't think that's the way to do it. I think that if you were going to institute user fees, and this is an if, you're going to institute user fees, you have to build it into a smart health card. And so when everyone goes every 5 years to renew their health card, they get a certain amount of credits put on that card, almost like a credit card. You pay for those credits when you go to renew your health card, perhaps $300, and you get perhaps 15 credits. And when you go to the doctor's office, and every time your card is swiped to visit the doctor, a credit comes off. Now, there can be some communication between Revenue Canada and the healthcare department such that people below a certain income don't actually have to pay when they renew. They get free credits.
Sure.
But this relies on communication between government agencies, which we know historically has been horrendously poor. This also relies on the healthcare system being card smart, which we know with the e-scandal in Ontario, $1 billion was wasted away to nothing.
Yeah.
So anytime you involve the government in any sort of decision-making process or involvement in another layer of bureaucracy, we know it's open to abuse. We know it's open to overspending and overrunning, and we know it's open to just simply poor fiscal management. So I would say to you, it's a possibility. Has the time come? I don't know. But it certainly can't be left in the hand of secretaries and doctors at the doctor's office. It has to be built into a smart health card. And frankly, I don't think we're there yet.
Well, I think we should be moving there because I think it's one of the solutions to a pressing problem.
See, I would argue that if you made the healthcare system more efficient and less costly, then you could solve the sort of the economic crunch that way. So instead of having people pay more, have the healthcare system be more efficient and be cheaper.
Obviously, everyone would agree that the healthcare system should be more efficient.
Right.
But in trying to do so, I believe one of the ways to make it more efficient would be to streamline the use of it. We have to do something about the outrageous and infinite use of the healthcare system.
I
agree with you. I
would agree with Paul.
No
and you know,
disagreement there.
I've encountered it many times in the emergency department where people come in with the slightest little problem. We know they don't need to be there.
Sure.
I don't know if they know they don't need to be there.
Sure.
But you know what? It's like you've got daddy's credit card and he's not going to find out. So just go use it at your will. If you're willing to pay, put up with the lineups, so be it. I don't know. Is it going to be there? We don't know, but we've got to go right now. Thanks for tuning in to our medical expert panel, and we'll see you next time. Thank you. Thank you. Welcome back to the show. This is a segment we call Second Opinion, where we answer questions proposed by viewers on the SenioLand.com website, and we try to give it our best answer. This is Dr. Kevin Rod. Kevin, I think you have a question for me from the website.
Yeah, a very common question from seniors who live in senior homes. They say that what they can do to manage their pain better and how can they be active in senior homes.
Well, I presume this relates to taking medications from a pain perspective. I know in a lot of retirement homes, there's staff that dispense the medications for the seniors, and certainly that happens in nursing homes. I think main thing is you need to make contact with a physician who's looking after you and state that you have a pain issue, and so they can actually make a medication order for you to have for your pain. Now, a lot of them are what are called PRN medications, which means you don't get it unless you ask for it. So you can't assume that they're going to give you your medication on a scheduled basis. If you're living in a senior's residence or a nursing home and you're in pain, you need to let the staff know there that you're in pain and that you want your medication. And if there isn't a standing order to give you medication, then you need to ask to have the local doctor who's looking after that retirement residence or nursing home to come in and pay you a visit and go through your pain issues with you and see if there's some pharmacological therapy that can be offered to you that you can request when your pain gets out of control and out of hand. Now, Kevin, you deal with this as well as a chronic pain physician.
Yeah, because it ties into ability to move around and being mobile, and that's important, especially when it comes to talking to them about self-management and doing exercises. I know in many of senior homes there are exercise therapists that would guide them, but a lot of time they ask that, I have this pain and that prevents me from being mobile. How can I do exercises? And there are a lot of things that can be done, like range of motion exercises using TheraBand, or you even going to water and walking in the water at the beginning. And
That would be aquatherapy, right?
Yeah, once you get better, you can even follow with aquatherapy and guided exercises. That doesn't need to be perfectly fit to be able to do the exercises. And that
And
can be
aquatherapy is particularly good because the resistance of the water acts to provide some resistance to build your muscles a little bit.
And on the other side, body becomes lighter.
The
So-
buoyancy effect.
Exactly, and then being light in the water helps them to be able to move better.
I think that's very good advice, Kevin. Don't go away. We'll be right back. Ladies and gentlemen, I want to thank all my guests for taking the time out of their busy schedules to join us today on the show. I want to thank my better half, Mr. Ari Kazel. We hope you found the show to be both entertaining and informative. Until next time, I'm Dr. Allen, yours in good health.